a new University of Georgia study highlights the stark gap between Alzheimer's care access. Rural Georgians often face hours-long trips just to receive diagnosis and treatment. Joining us now is Dr. Niang Lee, assistant professor at the UGA College of Pharmacy. Dr. Lee, welcome to the show.
Hello, Chesley. Nice to meet you.
Nice to meet you as well. What does this study reveal about the current divide between healthcare access between urban and rural communities in Georgia, especially when it comes to Alzheimer's care?
Yeah, so this study looks at access to the new Alzheimer's disease modifying drug named lecanemab. So how this drug works, this is not a cure, but this drug slows down Alzheimer's disease progression, but it's only eligible for early stage Alzheimer's disease. And to be eligible for the drug, you need to get a diagnosis and also be able to demonstrate that there is a protein accumulation in your brain called the beta amyloid. And this can be done using PET scan, amyloid PET scan, or lumbar puncture. But this study, we focus on the availability of amyloid PET scan in across Georgia. And after you get a diagnosis, after you demonstrate that you have this amyloid protein accumulation in your brain, and after you met all these exclusion criteria and you're willing to receive the drug, you will need to get to a lecanemab infusion center to be able to receive the drug. So there are a lot of steps to be completed by the patient and patient's caregivers. And this study showed that the availability of amyloid PET scan centers in Georgia is limited, and for people living for rural patients, they need to travel for about over an hour to get to the nearest amyloid PET scan center to receive the imaging services. And in terms of the distribution of lecanemab infusion centers, they are scattered around the Atlanta area. So for rural patients, to be able to reach the nearest lecanemab infusion center, the longest drive time can be more than 3 hours, single trip. So that creates a lot of burden, travel, financial, and all these logistics burden for patients and their family caregivers.
Your study mentions about 18 Georgia counties that don't even have a single medical physician in their area. That workforce shortage, how does that compound the diagnosis and treatment of this disease?
Yes, very good question. So as I mentioned earlier, you need to first get a diagnosis. And my study indicated that 18 counties in Georgia don't have family care physicians. And the family care physicians are the entry point to the healthcare system. They are the ones to refer you to a specialist, to memory care, to a neurologist, to a geriatrician, those specialists who are able to make a diagnosis for you so that you can be further consider whether you're eligible for the drug or not. But for people living in those 18 counties without a single family care physician, this is a huge burden because that doesn't allow you to get the first contact into the healthcare system.
Well, Dr. Lee, is there anything being done about that right now? Are we looking at these gaps and saying, how can we, bridge the gap here?
I would say the first option we can consider is the telehealth services. Telehealth services have been growing in the past several years. So maybe you can find a provider online who can answer questions about your memory concerns. However, not every provider provides telehealth services. And also telehealth services require that the place you live have good broadband internet access, which is again something that rural areas lack. And also whether the patient, whether the provider is comfortable with the technology is something we don't know about. So this is a promising area that we can explore, but there are also uncertainties.
All right, Dr. Lee, thank you so much for bringing attention to this matter. Really appreciate your insight this morning.
Thank you so much.
All right, take care.